Hello everybody, my name is Alex. I'm co-founder of Amass, and in this video I will show you how the Amass platform can help you with target selection. So imagine you're part of a target discovery team and you're tasked with selecting the next target for the next program you're working on. This is a very complex decision because you need to look at what's known about this target, are there any toxicology findings we should be aware of, but also who's working on this, right? Are there any patents that we should be aware of? Are there any trials that are already running looking at a specific target and our indication of interest? So this can take weeks and weeks of time. It's a very tedious task, but it's also a task that is usually very hard to standardize and come up with a good workflow across your team. This is actually where the Amass platform can help you a lot. We help you with setting up a template, which is what I'm going to show you in the video, that you can share across your team and run at scale to look at every single possible target in a very standardized, reproducible, and understandable manner, and thus make the best decisions. Let me show you how. Great. So I'm now in the Amass platform, and for this example, I will go to templates and create a new template. I prepared an example here that the target discovery team that I'm working on might have defined around certain criteria they want to evaluate for any target they're looking at. So I want to know something about the pipeline, clinical pipeline, the indication landscape, a competitive analysis of the sponsors of trials, but then also maybe an IP portfolio review, key patents, including their timelines, and who's the assignee of these templates, these patents. These are very easy to change as well. You can adopt them over time. It could be your own criteria, but let's just roll with this example. You will also see here that I'm already having a target placeholder and also an indication placeholder. But let's just go in and build our template, which is what I will do here. This will take a few seconds. All right, the template is generated now. The first thing you see here on the top left is placeholders for both the target, but also the indication to look at. At the same time, we're showing here a short outline of what the template contains. We can go through it here as well. And we have different sections. These sections are very much mirrored on what I put in originally. And for each topic in the section, for example, we have a key question of interest. So how many drugs are currently in clinical development targeting a certain target? For each of those, we also suggest a data context that is relevant here. So in this case, it's clinical trials and a web search. You can modify this as well. Also importantly, you can bring your own datasets, documents from both the Amass platform or upload them specifically for specific sections. You can edit the template as you want, as you learn more things over time as well. And it will be the one key place that defines how you look at a new target and how you evaluate targets as part of your target discovery team. Great, so let's go with actually running the template. I will go in here and all I need to do is filling in the placeholders. So for this example, I might be interested in looking at P53 in a context of cancer. And you can now see here that throughout the template, P53 or BRCA or whatever gene that I'm interested in will be filled out where it previously said target, and the indication, cancer, will also be filled in. Now everything I need to do to get an overview of this specific target is creating the asset, which is what I will do now. I confirm and run. This will take a few minutes. I don't need to wait for it to be done. The asset is done now, which gives me an overview of P53, the clinical IP and biological landscape around it. We also show you at the very top the key insights here, and that's that safety and patents are of course a major concern. We're looking at P53 in a cancer context. We give you a clear indication of what else you should be aware of. We also show you a small diagram of how P53 works in a cancer context. And again, you get this for every single target, so this is especially useful for targets you have not looked at before. And then down here you get the executive summary and all the sections we defined as part of the template. All the sections are transparently and reliably citing data context in the Amass platform. So that's papers, patent documents, clinical trials, regulatory filings, but also your own documents or even websites if you select so. Everything is up to you. The data sources you're defining up front, but then also importantly, you can reuse them for every single target you're looking at. If you hover over the sources here, this, for example, is a trial, and we found different trials, for example, for this section, looking at p53 as a target. So in this example, we looked at how the MAS platform can help you with target selection to make sure you as a team are selecting the right target. Come into the MAS platform. This can save you weeks of work. It's easy to get started and try it yourself.